Okay, so I want to take a quick minute to go over the substance use criteria with you. So it's pretty self-explanatory. When you open up the substance use criteria document, you'll see a pretty specific description that we use the DSM-5, which is this book right here. If you've never seen it before, this is our go-to for all things substance abuse and mental health. So if you don't have one of these, when you do get into the clinical world, I definitely recommend getting one. They are pretty expensive, so don't get one if you don't necessarily have to. And a lot of that stuff you can find online too. So there's 11 criteria that we take a look at in order to determine if someone has a substance use disorder. Please familiarize yourself with this. It's going to help you a lot throughout the semester. It's definitely quizzable. And then on top of that, it is best practice to be able to know this, because when you're working with a client and you tell them they have a substance use disorder, they're going to say, no, I don't. And you're going to say, yes, you do. And they're going to say, well, how do you know? And then you can reference this information to be able to really regurgitate that to them and say, listen, I'm not making this stuff up. This is stuff that's really real, and to be able to educate them. So the most important things to realize when reading this is that if you have 2 to 3 of these 11 symptoms that are occurring within a 12-month period, then you are considered to have an alcohol or drug use disorder mild. If it's 4 to 5 out of these 11 symptoms, it's moderate. If it's 6 or more, it's severe. So I also included down here the proper way to diagnose someone. So it's either alcohol use disorder, mild, moderate, severe; opiate use disorder, mild, moderate, severe; cannabis, hallucinogen, whatever. And then with stimulant use disorder, you had to have the specifier. So what is the stimulant that they're abusing? Is it Adderall? Is it K2? Is it crack cocaine? Is it powder cocaine? Is it crystal methamphetamine, etc.? You have to add that specifier in there. The other specifier you should add is if they're in early and full remission. So very much like any other medical diagnosis, if someone has a substance use disorder, what you want to do is add the specifier. If they've been 3 to 11 months sober, they're in early remission. If they're 12 months sober or more, then they're considered to be in full remission. But it's important to also add the specifier if they had been in a controlled environment. So if they were incarcerated, if they were in an inpatient facility for an extended amount of time, if they were sectioned, and let's say they have 2 months sober or something like that, then you want to add that specifier in there that they were in a controlled environment, because what's going to happen is once they're no longer in that controlled environment, their risk for relapse and significant potential harm increases greatly. So when you're doing integrated summaries, you want to make sure you have an appropriate diagnosis. So if someone in your integrated summary or in watching the video has an alcohol use disorder, you can put that in there, or cannabis use disorder, mild, whatever. If you can't tell what severity someone's use may be, you can put in a rule out. So rule out opiate use disorder, rule out alcohol use disorder, etc. And basically what that's saying is there's something there, I just don't know exactly what it is, and I don't know what the severity is, and I need more time with this patient in order to figure that out. So that's essentially how this stuff works. I would definitely familiarize yourself with those 11 criteria, because it is going to be very useful for you in the future, especially in this course and most especially in your career.